Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine, one of the large medical schools in the United States. Today we're going to talk about a recent research publication. It's very, very important in the people with cancer especially. As you know, a lot of times cancer, there are not many treatment options available for the patient. Even some of these experimental therapies, you have to wait to the last minute to have some kind of experimental study you can join, okay? So we're going to talk about a study published about a scientist who's a virologist who used virus to treat her own breast cancer. Okay, before we go into, let's look at this article. It was published in the magazine called Vaccine by MDPI, and the primary author is Dubravko Forsic, and the senior author Beata Halsey. Okay, a great article. So before we go into, when you look at breast cancer, is the most common cancer in the females. Unfortunately, 1 in 8 people have breast cancer, okay? So the chances of somebody having breast cancer is extremely high. And now, there are several treatments. In the initial stages, you can, excision, and there is chemotherapy, there's radiation therapy, you got hormonal therapy, depends upon what stage of the treatment. And the recurrence rate is like very common in breast cancer. Now, what is this oncolytic virotherapy? That means there are some virus can attack the tumor and kill the tumor tissue. That is called, those viruses used to treat cancer cells is called oncolytic viral therapy. Talk about the oncolytic viral therapy. You got these viruses which can kill tumor cells in the cancer. Okay, so experiments were been going on for a very long time about this viruses they can use, but the problem is they wait to the last minute, right? There are clinical trials. By the time you can join the clinical trial, you have to you have to use all other options. So by the time they have maybe 3 or 4 months to live in the world, this experimental therapy is starting to work, and unfortunately most of them die. So in this case, this virologist, she developed breast cancer, and then she wanted to treat herself experimentally. Don't ask me this is the right thing. Probably nobody support her what she did. But anyway, she did it. I think somebody have the courage to report it. A lot of times they don't publish some of these papers like this. So take a look. Let's go into this article and find out like what's going on. Again, this is a 50-year-old virologist with a locally recurrent triple negative breast cancer. And she had 2 recurrences in 2018 and 2020. Tumor's size was growing bigger, and it was infiltrating the muscles and all that. And then she decided to do was like, she's an expert virologist, and then she used the viruses, she injected the viruses in the tumor tissue, okay? Now let's look at the viruses, like what type of virus then they used. They used this Edmonston-Zagreb measles vaccine, prepared by Institute of Immunology, and vesicular stomatitis virus Indiana strain. Remember, all these are like high quality viral strains, okay? So she did use it like some viruses she developed and then all that. This is again a measles vaccine and vesicular stomatitis vaccine. And what she did was she herself injected this virus into the tumor cells. Okay, so she did like 7 injections over 3 weeks. With the one virus, and 3 with the other injections at weekly intervals. Okay, and single injection post surgery for this immune support. Okay, so she did like she made her own schedule, started injecting. So what happened after like 2 weeks? A remarkable thing happened. Tumor started shrinking. That's the most important thing. And like a lot of cellular level, a lot of things are happening to support destruction of the tumor. When you have I think they were reporting the baseline, she had only 10% of the lymphocyte, but after she injected this, it went up to 50% lymphocyte. That means there's a response against the tumor cells, okay? There is increased PD-L1 expression, and then other clinical finding is CD8 positive T cells went from 30 to 60%, CD20 B cells from 10 to 70%, macrophages increased immune infiltration by, again, CD8 and T cells and all of that. So remember that. So it's a huge improvement in the cellular level. And they also measured the neutralizing antibody titer to both viruses. That increased 100 times in the course of this therapy she did, oncolytic viral therapy. In this slide, you can clearly see, look at the slides before and after, you can see the infiltration of the tumor cells has almost disappeared. So the tumors start shrinking. One thing about this study is, she had a scientist watching her, right? It's not like she did it by herself, nobody else was watching her. Every stage they were watching her. They were doing MRI, they're doing imaging studies and all of those kind of things. They were checking the labs and all of that kind of thing, okay? So this, again, remember, there's a two vaccine they used, one of the Edmonston-Zagreb measles virus, which also targets CD46 and Nectin-4 receptors. They're highly expressed in breast cancer. And it may not work in the other cancer, you have to remember that. The other thing, the vesicular stomatitis vaccine is an animal pathogen, minimally pathogenic to humans, and they're effective in the preclinical models for the breast cancer. That's what they used it. Okay, so based on this study, her symptoms improved. She continues the regular treatment. She have adjuvant, I think she went and trastuzumab adjuvant therapy. She had surgery done, even if she injected all this. Remember that. She just she did not inject the virus and stop right there. Right? She just continued the regular therapy. Right now, she's been, I think it's almost 45 months, almost 4 years, and everything is, she's symptom-free, disease-free. Again, it's a great study, and it's good to report what happened, even though it's an individual finding. A lot of times in the public, we don't even consider. This is pretty much in the case report level, but more further studies need to be done. More clinical trials need to be done, and please, when you do clinical trials, give these patients an opportunity to get better, okay? So the key observation in the study, your sequential virus administration enhances the effectiveness of the tumor shrinkage and immunomodulation, okay? The limitations, again, it's only one single patient. Again, my take-home message from this study is, do not try to do this on your own, okay? If you are doing maybe some experimental, in a clinical trial, you have to join. And the investigators, my point to make is, please do not wait to the last minute for people with the breast cancer to administer novel therapies like this. Otherwise, what's going to happen? They have 3 or 4 months to live. They tried everything, chemo, radiation, and the tumor has gone into a stage. And then you try to do the experimental therapy, it's not going to work. So please, give people a chance for experimental therapies just early on. Maybe the life is going to be better. So more studies needed to be done, definitely. We cannot just take by one study, but more clinical trials need to be done. But again, it's a great effort in the future for the scientific community and the people to know there may be an option in the future. Thank you so much for watching. God bless.